blood pressure Part 1. You can have high blood pressure or hypertension and still feel just fine. That's because high blood pressure often does not cause signs of illness that you can see or feel. But, high blood pressure, sometimes called the silent killer, is very common in older people and a major health problem. If high blood pressure isn't controlled with lifestyle changes and medicine, it can lead to stroke, heart disease, eye problems, kidney failure, and other health problems. High blood pressure can also cause shortness of breath during light physical activity or exercise. What is blood pressure? Blood pressure is the force of blood pushing against the walls of arteries. When the doctor measures your blood pressure, the results are given in two numbers. The first number, called systolic blood pressure, is the pressure caused by your heart contracting and pushing out blood. The second number, called diastolic blood pressure, is the pressure when your heart relaxes and fills with blood. Your blood pressure reading is usually given as the systolic blood pressure number over the diastolic blood pressure number, such as 138/72. Normal blood pressure for adults is defined as a systolic pressure of less than 120 and a diastolic pressure of less than 80. This is stated as 120/80. Do I have high blood pressure? One reason to visit your doctor regularly is to have your blood pressure checked. Routine checks of your blood pressure will help pick up an early rise in blood pressure, even though you might feel fine. If there's an indication that your blood pressure is high at 2 or more checkups, the doctor may ask you to check your blood pressure at home at different times of the day. If the pressure stays high, even when you are relaxed, the doctor may suggest exercise, changes in your diet, and, most likely, medications. What if just the first blood pressure number is high? For older people, often the first number, systolic, is 130 or higher, but the second number, diastolic, is less than 80. This problem is called isolated systolic hypertension, which is due to age-related stiffening of the major arteries. It is the most common form of high blood pressure in older people and can lead to serious health problems, stroke, heart disease, eye problems, and kidney failure, in addition to shortness of breath during light physical activity, lightheadedness upon standing too fast, and falls. Isolated systolic hypertension is treated in the same way as regular high blood pressure, 130 or higher for the first number or 80 or higher for the second number, but may require more than one type of blood pressure medication. If your doctor determines that your systolic pressure is above a normal level for your age, ask how you can lower it. What if my blood pressure is low? If your blood pressure is lower than 90/60, you have low blood pressure or hypotension. You may feel lightheaded, weak, dizzy, or even faint. Low blood pressure can be caused by not drinking enough liquids, dehydration, blood loss, some medical conditions, or too much medication. Some high blood pressure risks you can't change. Anyone can get high blood pressure. But, some people have a greater chance of having it because of things they can't change. These are: age. The chance of having high blood pressure increases as you get older. Gender. Before age 55, men have a greater chance of having high blood pressure. Women are more likely to have high blood pressure after menopause. Family history. High blood pressure tends to run in some families. Race. African Americans are at increased risk for high blood pressure. If you have any questions, please comment below. Thanks for watching.